Hello everyone. So this video is going to be about Ultratag and how we use it to tag red blood cells for imaging for GI bleeds. Okay, you can do it for multiple other things, but we're going to focus on GI bleeds in this lab. So I will go over the contents of the Ultratag kit first, and then we'll go through the process of actually tagging the blood. Okay, so this is an Ultratag kit. It comes like this. Obviously it won't have the word expired on it. We're in a simulation setting, so this is an expired kit. Inside this kit is going to be a little package insert. You're going to have a radioactive label that you can place on the vial. You're going to have syringe 1, and you're going to have syringe 2, and you're also going to have 2 plungers, 1 for each syringe, and 2 needles, 1 for each syringe. And that will be in every Ultratag kit. Before we get the blood sample from the patient, there's one important thing we need, and that's heparin or ACD. ACD is anticoagulant citrate dextrose solution. It's a different type of anticoagulant, but it depends on the department which one they use. But either they use heparin or ACD to keep the blood from clotting within the syringe and outside of within that reaction vial. While we're doing all the chemistry with it before we give it back to the patient. So depending on which one you use will determine the amount you use. So heparin is measured in what's called units. So you'll use 10 to 15 units per ml of blood. And then for ACD, you can have a max of 0.15 ml of ACD per ml of blood. So it depends which one you use. But you have to use either one of those for an anticoagulant so that your blood does not clot during the reaction. Okay? And again, it depends on the department and what they use. I've always kind of used heparin. I know places that use ACD, it just depends. Okay. So in addition to the contents in the kit, you're also going to need a vial shield or a vial pig, which is this. You're going to need a pig with your shielded sodium protectant tank dose. You're going to need a 5cc syringe shield and a 5cc syringe and needle to pull up your dose before you administer it to the patient. And you'll also need another 5cc syringe and needle with to get the blood sample. So I've already pulled the blood up now, but you'll need an empty 5cc syringe and a needle to pull blood off the patient. We usually do that using a large bore butterfly needle. We don't usually pull the blood straight from an IV, just because there's already saline in the IV, so you can dilute the solution. Even if you pull some of that saline off and get a whole blood sample, you're possibly damaging the red blood cells as you're pulling it through that line. The butterflies give you a better whole sample with limited damage to the red blood cells. So that's why we use the butterfly. And we have to use a large gauge, usually 19 to 21. 18 is kind of the normal. Same with the needles that we use to pull up the blood and put the blood into the vial. Has to be a large bore needle, because the smaller the needle, the possible damage to the red blood cells. So we use a larger 19 to 21 gauge needle. This is a 20 gauge. 20 and 18 is pretty common. Okay, and also alcohol. So what we're gonna do, I've already gotten the sample from the patient's blood, so I would have put either heparin or ACD in here first, and then went to the patient and drew the patient's blood. Now I have my anticoagulated blood in this syringe, and I have it in a volume of about 2.4 cc's. You can have it anywhere between 1 and 3 cc's of blood. It can't be less and it can't be more. Only 1 to 3 cc's of blood. So again, in this kit, I have my package insert, which I really don't need. This will be used to put on the vial. We have a reaction vial. You can see it says Ultratag red blood cell reaction vial. I'm not going to use this real vial. I'm going to use a vial that we have for simulation. But usually it's kind of, it's not in here anymore, but in this vial will be some type of white powder, which helps get our tech to bind to the red blood cells. Okay, so the first thing I do is I keep the syringes in here. I'm going to pop off the top of my vial. This cap is just to kind of keep dust from it and keep it from being damaged. It does not keep it sterile. Okay, so you pop this off. The first thing you have to do is take your alcohol and you have to clean the top. So rub it for a couple seconds, and then you're gonna let that that dry. You're not gonna touch it again, okay? If you don't let it dry, you're not killing all the bacteria and germs that can be sitting there. So you have to let the alcohol dry to actually do its job effectively. So that's gonna take a second, and we'll let that dry. So what we're gonna do now is administer our blood into that reaction vial. And we wanna limit the amount of damage to the red blood cells. To do that, we take our needle and we're going to angle it kind of towards the edge of the vial, so that way the fluid can just run down the side of the vial instead of injecting it straight down and letting it fall halfway down the vial. These red blood cells are fragile, so we need to mitigate the damage as much as possible. So we're going to take this needle off, and we're going to take the bevel of the needle, we're going to insert into the diaphragm, and we're going to start putting that needle right against the edge and just gently adding fluid down the side to limit the damage. Now this is really important. Once I put all my fluid in here, this was a vial that was filled with air, and it's a closed system. So now I added 2.4 cc's of fluid that's displaced air. So now I have to pull that same amount of air out to reduce the pressure in this vial. If I don't, there's a possibility when I take this needle out that I'm gonna spurt blood or whatever contents are in this vial out. We definitely don't want that to happen with blood. So I'm going to pull out about 2.5 cc's of air to keep the pressure down essentially in that vial. Okay, so this is gonna go into our sharps, and we're done with that. Next, we have to gently mix the fluid with the powdered solution to create the solution. So we start doing that to get it dissolved, just nice and gently. You're not gonna be vigorous with it because you'll damage the red blood cells. Now at that point, I'm gonna set this down, and I'm going to let that react for 5 minutes, okay? During that 5 minutes, I'm going to get my tech dose prepared, and I'm going to get these syringe 1 and 2 prepared, okay? So I would go to the dose calibrator, I would get my dose out of the pig, put it in the dose calibrator to make sure I have the correct amount of tech that I want to put in there. The amount of tech that you can put into an Ultratag kit is anywhere between 10 millicuries up to 100 millicuries in a volume up to 3 ml. So there's restrictions on the amount of activity and the amount of volume. So a max volume of 3 ml and activities between 10 and 100 millicuries. That will give you the most effective tag. So it depends on how much you're going to administer to the patient. You can put more in this vial and only pull out what you need. So if you know the volume in here, you know how much you can pull out. If you put, say you put 40 in here, but you only need 25. You can pull out just 25 out of this vial, because there's some of it that's gonna get stuck to the edge of the vial. You're not gonna get everything out of it. So a lot of people will put a little bit extra into the vial and pull out what they need. Next, I'm going to get these ready. So the first thing you're gonna see is that the syringe has a little rubber stopper on the end. So the first thing you wanna do is add the plungers to my syringes. If I add the needles first, I have an open needle. If I press down on this plunger, I'll lose all my fluid. So with these, they're gonna twist on. So you push this in and you twist it onto the septum, or sorry, onto the plunger until it stops. Okay, so that's syringe 2. So I'm gonna lay this off to the side. And then I have syringe 1, I'm gonna do the same thing. So one thing I do to make sure I do everything in the right sequence is that I only put my needle on syringe 1 for right now, because if for whatever reason I get distracted, I'm not grabbing syringe 2 that also has a needle on it and putting that in the vial first. Syringe 1 has to go into the vial and then syringe 2. That's why they're labeled 1 and 2. So what I do is I take syringe 1 right here, which has the red text. I'm going to press my needle on, and I'm only going to do that to syringe 1. That way there's no possible way that I can put syringe 2 in first. I just do syringe 2 as I need it. So now for simulation purposes, we can say that 5 minutes has passed. So everything we want to do now for the most part is done behind the lead shield, because we're going to add tech to the syringe or to the vial after the syringe 1 and syringe 2. So I'm just going to move this in front to show that we're going to use radiation protection. I'm going to have my vial shield ready. Okay, So I'm going to put my vial there. I'm going to grab another alcohol wipe. I am going to clean the septum. Again, let that dry for a second. So every time you put fluid into this vial, you need to take the same amount of air out to keep the pressure from building up, to possibly push that blood out if there's too much pressure in there. Okay. So syringe 1, I'm going to take the needle off. I'm going to do the same thing, add it down the side, just nice and gently. Okay, I'm going to pull some air out. Perfect. I'm going to set this off to the side in the sharps. And now I'm going to invert nice and gently 4 to 5 times. So 2, 3, 4, 5. Okay. Now I'm going to take the rubber stopper off syringe 2, add the needle, and now I'm going to add contents of syringe 2 to the vial. Pull the same amount of fluid or air that I put in as fluid. Scoop the cap, throw that in the sharps, and again, invert 1, 2, 3, 4, 5. Okay, so now this is important. This is where we need to put our vial in the shield because we're about to add tech. Okay, so I have my syringe of tech. I have a volume of just under 1. I have about 0.8 ml. Okay, and obviously this is not a real dose, but we'll say we have 35 cc's or 35 millicuries of tech in the syringe. So now I'm going to insert into the vial and gently press it in. And although I can't see my numbers because I have a completely closed syringe in here, I know that I can just pull a little bit of air out about halfway to keep that pressure down. So then I'm going to get my needle, and that would go in the sharps, the hot sharps, take that out of the way. I'm going to put my cap on my vial, and now I'm going to invert again 4 to 5 times. So every time I add something to this vial, I'm going to invert it nice and gently 4 to 5 times. Okay, now that has to react for 20 minutes. So first we put the blood in, wait 5 minutes, add the rest of the contents, we wait 20 minutes. In that time frame, you can take this sticker and you put it on the vial, either on the vial itself, or some people put it on the outside of the vial shield, and write all the information, the patient name, the amount of dose that you put in there, the time, the date, all of that. Okay. Now we can fast forward and say it's been 20 minutes. Okay. There's multiple different vial shields out there. Some you can see, they'll put a window on the side where you can see it. Other ones will have a top that spins, so you don't have to take the lid off to pull the dose out. Those are probably the best ones. We don't have that one, we just have the one with the solid lid on top of it. So I'm going to take my 5 cc syringe, add my needle to it, and now I need to put it in a syringe shield because I'm about to add technetium to the syringe. So I want to shield it from the start because I'm gonna hold it the entire time. So I want to shield it from the beginning. So the first thing I want to do is take my shield off, alcohol, clean the vial, and again, let that dry for a few seconds. When I'm ready, I'm first going to take my needle off, and we have these little things called nerds. They are needle recapping device. So you just put the cap there, especially if you're going to reuse it like this. So I put my needle in, and then I turn this upside down. And since we don't have a lid, you kind of have to hold this one with your thumb a little bit. You're going to angle your needle towards the edge to get as much fluid out as possible. So now I am pulling out the solution. Okay. I'm going to take my cap. There we go. And now I have a dose of tagged red blood cells. Okay. So the cool thing is that you know how much fluid you put in there, so you know about how much you can pull out. Okay. So I pulled out just at 5, which sounds about right because I put about 2.5 of blood. I put 0.8 of tech, and then each syringe 1 and syringe 2 total about 1.6 mLs of fluid. So that's about 5 cc's of fluid. If we pull this out, there's going to be just barely anything in there. So there's just a little bit in there. So I pulled the majority of the dose out. In that scenario, I probably, in this syringe, might have close to 30. If I put 35 in, there's a possibility I have about 30 in this, maybe a little under 30 millicuries, which is a good yield. And now at this point, this is where I would be able to administer it to the patient. Obviously check their name, make sure it's the same patient's blood. That is a huge deal when you're talking about blood products. You want to make sure you're taking the blood from the right patient and giving it back to the same patient. And usually, the best practice is if you're the one taking the blood, you're the one tagging it and giving it back. That way you can limit the error on the side of the technologist. So that way the same person is taking the blood is giving the blood back to the patient, and that limits the amount of possible misadministration. So at this point, your vial would go into the hot sharps with the tech syringe, and then you would go administer this to the patient under the camera and do your GI bleed study.